So this type of eligibility check, it's not actually about eligibility and checking it. It's about disenrolling people in order to keep the number of people on Medicaid down.
Rolling forward, Dr. Sister Science Facts.
All right, let's get started.
Welcome to the Rolling Forward podcast.
I'm Dr. Stephanie Rolin.
I'm Dr. Alicia Rolin.
And this week, we got a doozy for you.
Do we want to introduce ourselves?
I guess I'll introduce myself first. I'm a psychiatrist who does clinical work and research.
And I'm a pediatric emergency physician who splits my time between the emergency department and research.
She just copies me.
What's the saying? Do but better? No. I am inspired by you.
Inspired, yes. Make it inspirational. So in this podcast, we break down the stories that are shaping our health with a focus on how it's affecting kids and families in America.
Rolling forward, Dr. Sister Science Facts.
And today, we are going to be unpacking a piece of legislation that has a really flashy name, but quite serious stakes. You may have heard of it.
The One Big Beautiful Bill Act.
I mean, what is that?
It's like the most Trump title ever possible. We're going to do this all in one bill, and it's going to be beautiful. It's going to be one big, beautiful act.
One big, beautiful bill.
In fact, here's him saying exactly that. You ready for this?
I don't think I am.
Thank you all for being here to support one of the most important pieces of legislation in the history of our country. And when we were thinking about doing it, we were going to break it down into 3, 4, 5, 6, or even 7 bills. And I said, let's make it one big, beautiful bill, Mike, right? They actually said it would be very much harder to get this way, but it would be better. And the truth is, I think it worked out well because there's something for everybody.
Okay, so this big, beautiful bill is being pitched as a comprehensive fix for the economy, and I mean everything else in America. Underneath that surface, it is actually a blueprint for some of the most sweeping changes to healthcare since the Affordable Care Act.
And spoiler, in the fine print, it might not be all that beautiful.
Unfortunately. So while this is a massive bill that is going to affect everything from taxes to defense, clean energy, education, food stamps, today we are going to specifically focus on healthcare because tucked into this bill are changes that are going to reshape how millions of people access healthcare in this country. And that is especially true for families with young children, families that have low income, and for families that are navigating any type of disability.
So one of the true things that Trump said is that this could be 3, 4, 5, 6, maybe even 7 separate bills.
But like vaccines, we're going to focus on the number. Just get the number as small as possible, and then it's better. I don't know.
It's better, and then it's better. It's better. It's better.
It's just too many bills.
It's better. So there's a lot in here about healthcare. And the first big section that this bill tackles is Medicaid.
Medicaid is a public health insurance policy that covers
70 million Americans.
70 million Americans and more than half of children in the U.S.
Through Medicaid or CHIP, which is the Children's Health Insurance Program, which is kind of housed in that same branch.
So in this big, beautiful bill, there are a lot of changes to Medicaid that are being proposed.
The first is proposing a transition of Medicaid funding to block grants. Now, we've talked about block grants before.
And the important thing to know here is that a block grant would give a set amount of money to each state to help fund Medicaid, no matter how many people need care. So there would just be a set amount of money, and that's what it is. Even if more people need care and you don't have enough money, it's a set block grant. There is no variability there.
Currently, there's kind of a more open-ended match system where the federal government covers a percentage of each state's actual Medicaid spending, and there's no cap. So if you spend X amount, the government will match X amount. With block grants, the federal funding will be capped regardless of the actual need or actual cost in a state.
So you can imagine that that would lead to some downstream impacts on how many people are able to be covered by Medicaid or what services Medicaid might be able to provide.
This has been something that Republicans have been seeking for a long time. They have reintroduced block grants to Congress many times. And the reason why this is really appealing to some of the Republican members is that it typically gives states more control over how Medicaid funding is used.
Another change that this bill is seeking is to introduce work requirements for people who are on Medicaid. And this includes for people who are parents caring for small children.
We have also talked about this before.
It is popular among Republican lawmakers to focus this idea that there are people on Medicaid who are sitting on the couch and not working and benefiting from public insurance. That is not the reality. That is the myth. Most people who are on Medicaid are either already working, disabled and unable to work, or they're unable to be in the workplace because they're caring for children.
According to 2023 of the Kaiser Family Foundation, which is a research organization that does a lot of Medicaid statistics, they found that 92% of adult Medicaid enrollees are either working or exempt from work requirements. So this is really affecting a very small portion of Medicaid enrollees.
And yet, so much of the conversation.
Such a huge focus.
This bill is also seeking to introduce new fees for anyone on Medicaid who is above the poverty line, so that they would have to pay fees in order to access health care. And to be clear, this is for people who are above the federal poverty line.
I'm searching the web. The current federal poverty line for most states, it varies a little bit in Alaska and Hawaii. For a one-person household, so someone like me who lives independently, is about $15,000. If you make more than $15,000, you're going to have new fees.
And for a family of four in America, the federal poverty line is about $31,000. This is not enough money to live independently or to raise a family in any place in America that I've lived or have traveled to. So the idea that a family is living at the poverty line and is now going to have to pay more fees, it's just hard to, I can just imagine how much that's going to harm families.
And not only is Medicaid going to be more expensive with more fees, this bill also introduces more work for Medicaid enrollees. There will be more frequent eligibility checks where you have to prove that you are eligible for Medicaid. And these checks will be more detailed and more often.
And these types of checks are often designed to reduce the number of people on Medicaid by kicking people off. Maybe they have to re-enroll every 3 months now instead of every 12 months. They get a detailed packet in the mail. And if you're one day late with that packet, you're kicked off Medicaid and then you have to re-enroll from the beginning. So this type of eligibility check, it's not actually about eligibility and checking it. It's about disenrolling people in order to keep the number of people on Medicaid down. It feels like these types of checks aren't about actually making sure someone's eligible for Medicaid, but rather to disenroll people for not filling out paperwork quickly enough, rapidly enough, disincentivizing people from being on it. And so that you're going to have less people on Medicaid, not because less people are eligible or less people need help, but just because you've made these checks so frequent, the fees so high, and the requirements so much that people just can't keep up.
It just feels like this overarching idea that people are lying and aren't deserving of Medicaid, and we're going to kick off freeloaders, which is not what Medicaid is in the United States.
Medicaid is public insurance for families that need it, and half of children in this country need it. So to make it harder for families to access health care is something that does not make sense to me.
Along with these changes in Medicaid enrollment, Medicaid funds are also going to be scratched from certain areas of medicine. This includes funding for gender-affirming care, including for adults. So we've had a lot of discussion about banning gender-affirming care for minors. With this OBBBA, the bill would prevent people, even those who are 60, from using Medicaid funding for gender-affirming care.
And then there are more restrictions on healthcare for undocumented immigrants. So right now, some states do choose to provide Medicaid coverage to people who are undocumented using state-only dollars. And states are doing that because it makes financial sense to help families access preventative care, because if you don't get preventative care, you're going to need more expensive emergency care. And this bill says that there will be reduced federal funding if states are using any of their own state dollars. So these are dollars that they've collected that they have the right to decide how to use. If they use any of that to provide Medicaid coverage to someone who's undocumented, they are going to face reduced federal funding.
A lot of these ideas aren't new, and they've been introduced in Congress many times before. We're just rebranding them a little bit. We're calling them something new. It's big and beautiful.
This bill is also coming for the Affordable Care Act.
So the Affordable Care Act was a major overhaul to the American healthcare system that passed in 2010.
In addition to expanding eligibility for Medicaid, the Affordable Care Act also created a marketplace where people could buy health insurance at lower premiums and with subsidies. And since 2010, nearly 50 million people have gotten healthcare coverage through this marketplace.
While in the past there have been a lot of efforts to repeal and replace the Affordable Care Act, the Affordable Care Act is actually really popular. It's been one of the most popular and most successful bills that have passed. I know it's more than a decade. Oh my God, it's 15 years ago.
Yeah.
In the past 15 years. And currently, over 60% of Americans view the Affordable Care Act really favorably on both sides of the aisle.
And if you ask people, do you like Obamacare? Some people are going to say no, just because they're not going to like anything that's called Obama anything. But when you actually ask people about components of the Affordable Care Act, things like the Medicaid expansion, things like this marketplace, people like these individual components and have a favorable view of it. It has been good for the health of this country, especially for the health of children in this country. And we're at a place where the uninsurance rate is at the lowest that it's been, largely because of the Affordable Care Act.
But this big, very beautiful bill is going to change a lot of what the ACA has put in place. It has plans to shorten the enrollment period where you can enroll for new insurance through the marketplace. They're going to restrict special enrollment windows. If you lose your job, if you change jobs, even if it's not an open enrollment, right now you can enroll for a new insurance in these time periods of big life changes. That will become more difficult to do.
And it's also going to end automatic enrollment. And now, if you hear these together, shorten the enrollment period, restrict special enrollment, and automatic enrollment, none of this, again, is about verifying eligibility or appropriateness. This is all about making it harder for people to access the healthcare that the law and the government is providing. It's just about making it harder to get there.
And that people like and want. Over 50 million people have used this to gain coverage. And surveys have showed this is what people like and want.
But we're going to make it harder for them to access it because that's the way we can save money. I mean, in the short term. But eventually, people have to pay for things. So that'll be another issue. But this will make the numbers of the bill look good.
On top of that, there are plans to let some of the tax credits expire.
And these are tax credits which were expanded under the American Rescue Plan and the Inflation Reduction Act to make it easier for people to purchase healthcare in the marketplace. And this is a big deal because those tax credits helped people afford coverage. Without them, it's expected that millions of people will be priced out of being able to afford healthcare and that we are going to see the uninsurance rate in this country rise.
One of the most amazing parts of the Affordable Care Act is that it removed pre-existing conditions. It meant that people that had cancer, people that had autoimmune diseases, people that have medical problems, which is a lot of adults, they couldn't be charged a higher rate by their insurance company than someone who doesn't have that problem.
And while this bill doesn't explicitly bring this pre-existing coverage back, it is repealing protections that are helping people with pre-existing health conditions get coverage and have essential benefits.
Did you know that before, health insurance for women was more expensive than for men?
Which is gross.
Because women live longer. That was the reason, that women live longer, and so therefore their health insurance should be more expensive.
And when we think about in this country, women are earning less than men for the same work. And now we're charging them more for healthcare. I mean, how are people supposed to get ahead?
So it'll be interesting to see how this changes if this bill goes ahead. And like, are we recreating high risk pools? Are we going to recreate price differentials based on your age, your gender, your medical problems?
So that's what's in the bill. Significant changes to Medicaid intended to reduce the number of people who can use it, and significant changes to core pieces of the Affordable Care Act appearing to want to restrict the number of people using it. So, Alicia, this is what's in the bill, but is there anything missing from it?
There is a lot that is surprisingly missing. If you control F through the whole thing, there's just these huge gaps that aren't addressed.
One that really stood out to me was the lack of mental health parity. So mental health parity, I think, is critically important. We've discussed it here before, but it's the idea that insurance companies must provide similar coverage for a mental health diagnosis like depression that they do for a physical health diagnosis like diabetes. That we can't stigmatize or block people who have mental health disorders from accessing mental health care. And there's nothing in this bill about mental health parity.
Another huge gap that isn't addressed is the plan for long-term care. The population in America is aging like much of the world, and there really isn't a solution about long-term care. Currently, Medicare covers short-term medically necessary care, typically after someone's hospitalized or seriously ill, and that includes things like a skilled nursing facility for up to 100 days. After that, what's the plan?
You're on your own. There's also no comprehensive strategy about drug pricing reform. We've been hearing so much about how this administration is not going to have conflicts of interest with pharma. Sure, there's some language in this bill that talks about price transparency, but there's no comprehensive strategy for any type of drug pricing reform, like something Medicare negotiation, right? That's not here. That's not here. That's not anywhere. And so what is the plan?
There are also some current protections that are quietly being let go, letting expire, being replaced, being repealed. And that includes some of the preventative care coverage mandates. So
vaccines? Is it vaccines?
So under the Affordable Care Act, all preventative medicine had to be offered for free.
Vaccines?
Vaccines were included in there.
Goodbye.
I mean, that has been this entire administration. Goodbye, vaccines.
And then also coverage for specific screening. So things like cancer checks, mammographies, even access to birth control. We're really seeing these protections just quietly disappearing.
And so if you're worried, I'm worried, you're not the only one. Healthcare systems and hospitals are freaking out.
That's a good way of putting it. They are freaking out because about 40% of hospitals in the United States are already operating at a loss. This is especially true in rural areas and for safety net hospitals. And if you start shrinking Medicaid, many hospitals could close.
As a pediatrician, as someone who works in a pediatric hospital, I'm worried about what this means for children's hospitals. I work at a standalone children's hospital. The majority of our revenue comes from Medicaid, as the majority of children in America have public insurance or no insurance. If you're reducing the amount of children that have public insurance, you're just significantly decreasing the revenue when our hospital is already having negative margins every year.
At the same time that you're hurting rural hospitals, safety net hospitals, and pediatric hospitals like where Alicia works, it's expected that the hospitals that are going to do the best here, for-profit hospital chains,
which are hospitals that are required to prioritize cost over care.
But I thought this administration was tackling these conflicts of interest in healthcare
by having not-for-profit hospitals suffer.
So yeah, people would be freer to make decisions about what they want their health insurance to cover. But the reality in public health is that these changes overall are going to cause people to lose coverage, get denied care, and receive larger bills.
In fact, the Congressional Budget Office estimates that if this bill is passed, about 16 million people in the United States would lose health insurance. 16
million.
That's about 8 million from the changes in Medicaid. and about another $8 million in changes from the ACA marketplace and from the tax credits.
This is devastating that we would see this rise in uninsurance rates across the country after a decade of steady declines. And it's expected that children, parents, and low-income families are going to be the hardest hit.
This is just a huge rollback of all the progress that we've made in the past 15 years.
And it's moving so fast that people are not even having time to read the bill and anticipate the changes before voting.
Getting the bill text, we got it within a 72-hour window before voting on the bill. The issue is not about Marjorie Taylor Greene didn't read one small section on page 248 out of 1,100 pages. A clause that is in the One Big Beautiful Bill would take away state rights to make laws or regulate AI for 10 years.
A line in a new bill could drastically change our federal government's system of checks and balances. And a Nebraska congressman says he didn't even read it before he voted on it.
I am not going to hide the truth. This provision was unknown to me when I voted for that bill. You didn't even read it?
Alicia, is there anything in this bill that could be good for healthcare?
I mean, potentially.
Give me something here.
There are sections in this bill about improving price transparency in hospitals, about repayments for telehealth, and about prioritizing innovation. But
that sounds good.
They're kind of like double-edged swords.
Yeah.
So one of the good things about price transparency is that the goal is to ban pharmacy benefit managers, things like CVS Caremark, from, quote, spread pricing. They're also pushing for more hospital transparency, having more listing of pricing so that you know what you're going to be charged and you don't have a surprise bill, which would be amazing. No one likes getting a surprise bill in the mail.
And then the fast tracking of medical innovation does sound good. But in order to fast track, you have to loosen some of the regulations. So, for example, experts are saying that loosening FDA requirements in order to allow fast tracking of medical innovation could reduce safety, where the FDA would be reviewing less robust evidence on shorter timelines, and that this speed over careful scrutiny could really harm safety.
And yet vaccines that have decades of evidence.
No fast tracking. No. It's only for these wearables, right? We got to fast track that. So where are we now with this bill?
So this bill is introduced in a very interesting way, and this is through what's called a budget reconciliation process.
And they've done this in order to let the Senate bypass a filibuster, which would require 60 votes. Republicans only have 53 seats in the Senate, so they can pass this bill with a simple majority rather than needing 60 votes as a regular bill.
The requirements for this reconciliation process is that the House and the Senate have to pass the exact same bill.
And they want to pass it by July 4th. So this week is what they're hoping for. But it's unclear that that's going to be possible.
Considering that it's 3, 4, 5, 6, even 7 bills together, that's a lot to agree on every single fine detail between the Senate and the House.
So, Alicia, what can people do now?
If you are on Medicaid, or if you are receiving your insurance through the ACA marketplace, call, email your state representatives. Ask how they'll respond to these changes to block grants. Ask what your state is planning on doing with some of these changes.
And if you shop for insurance through the marketplace, read the fine print. Be very careful about new exclusions that might come in, especially around access to reproductive care or gender-affirming care.
If you're unfortunately one of the people that might lose coverage with this change, you still have rights, you can still appeal, and you can still file state complaints.
So if you're worried, now is the time to speak up. Call your reps, because state leaders do respond to public pressure, especially around healthcare, which is so personal.
And that's the overall summary of the major healthcare portions of the One Big Beautiful Bill Act. It's sort of a blueprint of who could receive care and who wouldn't under these new guidelines.
And here at the Rolling Forward podcast, we are going to keep covering this with you. And in order to do that, This summer on Rolling Forward, we are going to be heading to the highest court in the land. And no, not for jury duty. This summer, each episode is going to break down one Supreme Court case decided in 2025 and examine how that decision is going to shape healthcare and education.
Because the Supreme Court has way more say in your everyday lives than you think.
So if you've ever wondered how 9 justices in DC impact your kid's next doctor visit, this summer is for you. We will have new episodes weekly, so bring your curiosity as we will have the case files.
So stay tuned, subscribe, and share this episode.
Because it's not just policy, it's personal. So if something about this stood out to you, share it with a friend. Send it to a family member. Let us know. We'd love to hear from you.
You can reach out to us on social media, or our email is rollinforwardshow, ROLIN_show@gmail.com. I never know how to end.
Peace out. I don't know.
Until next time, where we start talking about the Supreme Court.
Get ready.